Hi, welcome everybody to our NASW Texas Voter Advocacy Committee interview. This is our second video recorded meeting, and we have Dr. David Conley here with us today. Um, and I have the Voter Advocacy Committee with me. My name is Victoria Highland. I am the chair of the Texas NASW Voter Advocacy Committee. And I will let my coworker or my teammates introduce themselves real quick.
So I am Dr. Tiana Charles, and I am a licensed clinical social worker here in Texas. Um, and yeah, I'm in the San Antonio area.
Hi, Dr. Charles. It's so good to meet you. I'm Louise Lynch, and I am a retired social worker here in Austin, Texas. My practice was primarily in administration and planning.
And
Hello. Oh, sorry.
no, go ahead.
Go ahead,
Sorry.
Alexis.
Hi, my name is Alexis Scott-Nicky. I'm the Chapter Services Coordinator with NASW Texas, and I'm also an MSW student in my last semester doing field at work-based placement with NASW as well. So I'm working with the Voter Advocacy Committee this semester in an intern role.
And then we have David Connolly with the University of North Carolina, Wilmington. I Our committee has cited one of his research papers in some of the things we have looked at in the research we've been doing. And so we wanted to invite you on to kind of tell us more about yourself and the research you've been doing in regards to political social work. So do you want to go ahead and introduce yourself?
Sure. And do you want me to go ahead and kind of talk about, how I got into all of this as well right now, or do you want me to wait
Oh,
for that?
yeah,
Yes,
please do
your
that.
social work origin story.
Sure. So my name is David Conley. I'm an associate professor at UNTW. I teach primarily social policy courses for the MSW students. I also created a political social work elective, and then sometimes I teach the human behavior course and some other things. But my main focus and the main classes that I teach are social policy and political social work. So I went to Virginia Tech for undergrad way back when,
Mm.
and I wanted to be a criminal profiler. But early on, my guidance counselor told me that there were only like 20 of those left in the United States. I wanted to be a CSI guy, basically. And she was like, "Yeah, that's sort of a dying profession. You might want to look for something else." So that was a bummer to hear, but that got me into psychology in sociology, and I was a double major. And kind of looking back, I sort of created my own social work major without even realizing it. They did not have social work at Virginia Tech, by the way. My 21st birthday was the Virginia Tech massacre, and so I was on campus for that. I had actually met the shooter before, and luckily, I didn't know anybody, but it really got me really, really interested in mental health. Not to say that people with mental illness are more violent than others. It's actually opposite. People with mental illness are less violent than the general population, but it still got me super interested in mental health. And I graduated and worked at a psych hospital for a year, and I got to work on all the psych units, and I really got to see the shortcomings of the behavioral health system. And got super burnt out and quit after a year. Bartended for 6 years, tried to figure out what in the world I wanted to do. Still hadn't heard of social work yet, by the way. Um, and thought about law school, thought about advertising. And finally, when I was 26, my friend told me about social work. And I was like, that seems like a really good way to integrate all of my interests into one thing. Um, and so I went to the MSW program at VCU, and I was actually a clinical MSW student, which is hilarious looking back now. But I wanted to be a therapist for college students. And as I had my internships, I kind of realized how poor of a therapist I would be. I have zero patience, and I think my talents are better suited in the macro area. And so after graduation, I went and interned for a state senator, and that's where I learned the political side of things. I got to really see how the sausage is made at the state level and the local level. And I got to intern for um, Jennifer McClellan, who was the senator, but her chief of staff was a social worker, actually. So I got to see politics from a social work lens, which I think was incredibly, incredibly important. I got a job as a policy manager and lobbyist for a couple years, and that's where I learned the policy side of things. So you can see how all these things are starting to come together. And I decided after a couple years I wanted to do a PhD to really set my own agenda, and try to address some of the issues that are happening in our profession for ourselves and for our clients. And now I really, my dissertation was on behavioral health bills and how we can, um, I guess, how we can better get them passed at the state and federal level. But now I really focus most of my work on political social work and how social workers can become more political. So that's kind of my journey. And I know if you talk to most social workers, we all have crazy journeys on how we got here. Um, but in my case, I really think that each step along the way made me a better social worker now. So that's kind of my origin story.
Wow. I have to make two comments. One is I saw Nikki Giovanni before she passed away,
Hmm.
and she was talking about being at Virginia Tech at that time.
Hmm.
And so it, when I think about how long ago and how those things make such a difference in our lives,
Hmm.
when we have those kinds of incidents happen and how they affect us.
Yeah, and Virginia had a multitude of bills passed that year improving mental health services across the state and reducing gun control across the state. It's a shame that those things have to happen for us to
Hmm.
get policy windows like that, but we did see a lot of change. And I also saw her speak while I was there, and it was a great privilege to see her speak. So, yep.
Yeah. Mm. Of course, I resonate with that remark about the sausage being made
Hmm.
because I know when my son was very young, he called me a sausage worker. So
Mm.
there it is.
Hmm. Uh-huh. Yep, it really is. It's really interesting to watch too. You can be lobbying a certain legislator for years to no avail on mental health, and then their daughter gets severe depression, and then all of a
Hmm.
sudden they switch their vote overnight.
Yeah.
Um, and so those are the things we're battling against. But yeah, that's
Hmm.
kind of how I got into this. I know it's a long winding road, but that's kind of why I'm here.
Well, thank you for sharing that. I do see some overlap in our timelines for social work because my undergrad was in psychology at the university you would teach at.
Mhm.
And I was in grad school or undergrad around the time that that shooting happened.
Hmm.
Wilmington's just a hop, skip, and a jump from Virginia Tech. So I remember hearing about it. Um, so yeah, that's kind of interesting how past kind of correlate sometimes.
Yeah, and it's
Um,
really interesting how many students have not heard of that now,
Well, yeah. Mm.
which is kind of interesting, very interesting to me. Yeah.
yeah, it it's amazing that people haven't heard, but I guess there have been so many shootings,
Right.
unfortunately, that
Right.
it's hard to remember everyone that happens.
That's true.
Um, which kind of goes to like I know you kind of introduced what political social work was, but what exactly is political social work in your experience?
Yeah, so um there's a great, first of all, a little plug for one of my colleagues, Shannon Lane. She wrote the first political social work textbook with Suzanne Pritzker, who used to be at University of Houston. And they define it as basically you're navigating power dynamics to create some kind of social change. Um, and you do that in five ways. One, you try to expand the political power of the profession and your clients. Traditionally marginalized groups. So number one, you're trying to expand political power for yourselves and your clients. Two, you're really trying to influence the policy agenda. So that's where all the advocacy comes in and the lobbying comes in and trying to influence people's votes on
Mm.
certain issues. Three, it's holding professional and government positions. So not necessarily elected office, but government positions. So it could be
Mhm.
any of the departments at the local, state, or federal level. But just being in those rooms, holding those positions is a huge part of political social work. Four is engaging with electoral campaigns in some way. So you volunteer for a campaign, you get an internship at a campaign, but you're influencing people to try to vote for that candidate in some way. And then five is actually running for elected office
Mhm.
ourselves. I forget the exact number. I want to say, I know it's over 200 social workers in elected office across the country, but I'd like to see that number increase substantially. I think we can do better. For example, in North
Mhm.
Carolina at the state level, we had two state senators and one recently um, decided not to run for re-election, and now he's an executive director at a really important organization. So that's great that he's doing that, but I'd like to see more social workers run for office. So those are the five
Mhm.
kind of domains that encompass political social work according to Shannon and Suzanne?
I don't know that this is a question, but what do you feel like is needed for social workers to get the confidence to run for office?
Yeah, well, first, we need to do a better job of branding social work. I think a lot of social workers think we're supposed to be neutral, and that couldn't be farther from the truth. I think many social workers are getting into this profession to be therapists, which is totally fine. We need therapists and we need good therapists. But the beginning of our profession was not therapy; it was macro social work. And we're one of the only helping professions that have political participation in our literally in our code of ethics. So it starts with the schools. We need to do a better job of incorporating political social work in all classes, including clinical classes, because it really does affect everything that we do, whether it's micro or macro. We need to do a better job of getting political internships and field placements for both macro students and micro students. Um, and right now, we need more macro tracks. I would say eventually and ultimately, I'd like to get rid of all tracks and have students just get a good education, social work education in both micro and macro um, classes. But right
Mhm.
now, it's so skewed micro. I think it's like what 85% of graduates are micro that we have to make macro tracks to get it more on the
Yeah.
agenda of students coming into school, which again goes back to the branding thing. And once it evens out a bit more, I think we can go no concentration, no tracks. But I think it starts in the schools. We got to get students more confident. We got to get students realizing that it should be a part of their job, regardless of which concentration they choose. And I think we need more political social workers who are saying they're social workers because there's a decent amount of social workers in politics that don't even say they're social workers, which really bums me out. So those are some things that
Mm.
I think we can do a better job of.
So, around the issue about political social work, one of the things that you said in the definition really had to do with the the power, like changing power dynamics, especially for colleagues and clients. And that kind of segues into my question about, those kind of nuances between political social work as it is and civic engagement as part of what we do anyway, and how we kind of maybe bridge those things together in practice.
Well, civic engagement's more, to me, it's more of like a broader term.
Hmm.
You're basically individually and collectively taking action against some sort of or on some sort of concern to improve the well-being of communities. But it doesn't, to me, it doesn't have that social justice lens, where you're specifically trying to help traditionally vulnerable and marginalized populations. But they're definitely related. I think political social work's under the umbrella of civic engagement, and I think both are important. There's many ways to be civically engaged without doing one of those five things that I mentioned earlier.
Hmm.
So
Hmm.
political social work's just, I think, a little bit more specific version of a way to be civically engaged. I mean, you voting is
Right.
civic engagement, protests are civic engagement, so those are, and in some ways, voting might be the most important thing of all, because if we voted in the right people, we wouldn't have to advocate as much, right? So, um, you definitely don't want to skip over those things, but I think political social work's just a little bit more of a specific piece of the overall umbrella of civic engagement. If that makes sense. That's at least how I see it.
Hmm. Hmm. Yeah, okay. So you're seeing more pointed toward that advocacy and political engagement is more pointed toward that advocacy rather than the umbrella term of civic engagement.
I think just political social work is more focused on vulnerable and traditionally marginalized populations, where civic engagement uh could be anything really. It could be
Yeah,
any
yeah,
concern in the public eye. But that doesn't mean it's not important.
yeah, yeah.
Yeah.
Thank you for answering that.
Hmm.
I want to move us on to how we got connected with your name and what brought us to ask you to do this interview. We came across the need for political social work, and we saw that 47% of social workers were highly engaged in political action, which is less than half, and
Hmm.
20% are even completely disinterested. And so we wanted to see, because I know the data from that was a little bit older, what is the current research showing, or what are you seeing with your research?
Yeah, less than half of political social workers are highly engaged. A little bit higher of a percentage are engaged somewhat, which means like they vote, or they care about
Yeah.
politics in some way, or they watch the news, things like that. But highly engaged are things like they talk to their legislators, they advocate for something. So the way that they define those terms is important. The 20% is 20% thought that politics was irrelevant to their work. That was the specific piece of that 20% number, which is incredibly discouraging. But like you said earlier, both of these data points that you brought up are older.
Hmm.
One of the problems is that we really don't have many people doing research on political social work, at least that I've seen. CSWE and NASW and some other organizations, I feel like they used to ask more questions in some of the annual surveys that they did about political participation and macro tracks and things like that. And I just haven't seen that much of that recently. And so one of the things my colleagues and I are trying to do now is create an annual political social work survey with all of these questions in it, like political interests. So first of all, do you even care? Are you interested in politics? Second, do you actually do it? Are you participating in it? Third, what are some barriers if you're not participating? So all those types of things will be in the survey, and we hope to distribute that to state chapters of NASW, NASW Federal, CSWE, some of the licensing boards, schools of social work, so we can survey students and faculty also. So not just social work practitioners, but also students and faculty. So we can get a good idea of, so we can begin to generalize some of these answers because, yeah, we can spout these stats and they are important and they are discouraging, but we don't know if that's still the case. I mean, it could be worse. We don't know. I would venture to guess, given what's been happening, I'm hoping that it's better. And some of those stats come from papers that have relatively low sample sizes, which
Hmm.
again illustrates the need for more research. And so that's kind of why I've been refocusing my efforts on political social work overall versus specifically behavioral health, if that makes sense. Because this was really concerning when I started diving in. Did that answer the question? I think I answered it somewhere in there.
Well, I wonder because I think, a number of social workers wouldn't consider themselves titled political social workers, right?
Right, right.
So part of the question for me, I guess, just, curiosity more than a question is that you have people who aren't necessarily going to be identified as such, but who may or may not be involved or engaged, right, in the
Hmm.
actual activity of political social work. Um, and then I was also intrigued by the fact that you mentioned um, distributing to licensing boards. So
Yep.
these are people who are licensed as social workers, but may or may not be NASW members, meaning
Hmm.
specifically tied into our code, right? In
Hmm.
terms of the code of ethics. So that, I mean, that seems to be another little tangle, and we're looking at who is it that we're surveying and what
Hmm.
kind of information do we think we're going to get?
Yeah, and that's a good idea. Perhaps we add a question on whether they're an NASW member or not. Uh, but yeah, we want to get a good sample of both clinical social worker practitioners and
Hmm.
traditionally macro social work practitioners, and then students and faculty from a variety of different concentrations, just so that we can get the pulse of what's happening, and
Yeah.
also identify gaps in terms of where we can reduce some of those barriers that people feel in terms of why they don't participate. Um, but yeah, that's it's we have a draft finished, but we're looking to finalize that and shore that up a bit and send that out. I don't know, hopefully fall, winter. But
Oh,
I'm hoping it's
good.
going to be, yeah, but I'm hoping it's going to become an annual thing,
Hmm.
because we really need to know patterns, uh, and, and I'd like to know this sort of information um, every year, and also like what are the differences in people's participation when there's a Republican versus a Democrat in office at the presidential level? What about the state level? So we can, if we could, this can become an annual thing, we'll begin to see and identify patterns, and then we can address gaps. So.
I know for us, one of the things that we've been kind of focusing on and emphasizing is also local elections
Hmm.
and people kind of starting there and kind of, being able to see the impact of whatever it is that they're doing on their
Hmm.
local communities.
Yep.
And so, having
We did.
questions that have to do with, you know, that little piece too as well.
Yeah, it's interesting. Some of the older surveys did not have local government involved,
Hmm.
as questions or as
Yeah.
variables, and we did add those
Oh, good,
because,
good.
yep, because, myself included, many people start at the local level and they build their way up because,
Yes.
there's less pressure when you make a mistake, there's less people affected. So there's, all sorts of reasons why, and you can see results quicker sometimes at the local level. So all sorts of reasons why they would go local first. So I think it would be important to include. Yep.
And just because I'm aware New Hanover County had actually amazingly high turnout in the last federal level election. What impact did you see in at a local level with the increased voter turnout in the most recent federal election?
Hmm. At the federal level, I think we saw increased voter turnout in a lot of places, if I'm not mistaken. So I think people were um, just more, I wouldn't say polarized, because that's kind of a, uh, as some recent research I've done, this is some good news, by the way. I have some good news. People in general are less polarized than we think we are politically. We all want the same stuff. We just want it in different ways. Politicians are the most polarized that they've ever been in history. So, and we keep seeing that in the media. We're seeing that in their agendas, and
Hmm.
so that some people think that trickles down into constituencies, but the research suggests that we are less polarized than we think, which I think is great news. But I think because of the increased polarization of a lot of these politicians, you're seeing increased voter turnout, which again is good. We want that. But at the local level, I don't know. Well, I'm in Mayfair, and I mean, there's a lot of privilege in Mayfair. There's a lot of not a lot of diversity in Mayfair in terms of gender identity, race, ethnicity. There's just not a lot of diversity. So
Hmm.
in terms of where I voted, I'm not sure why we saw more turnout, if I'm being honest. But if I'm speaking to why we saw more turnout overall, those are some of the reasons. But again, I'd like to see more turnout from traditionally vulnerable and marginalized populations, but unfortunately, there's a lot of voter suppression happening, and that's increasing. Um, and so, whether their needs are going to be met in future elections until we get more people registered to vote is something that I think we need to be concerned about as NASW state chapters.
Yes.
Definitely North
Mhm.
Carolina, for sure.
And Texas has had low voter turnout. More recently in the runoff elections and the
Mm,
local elections, there's been higher voter turnout, but because of a lot of the barriers to us being able to vote, um, which we'll get into in the next set of questions, there's just traditionally a low voter turnout here. And
mm,
so we're part of what we're looking at is how to increase both civic engagement and voter turnout, both amongst social workers and our clients, because we live
mm.
in the communities our clients live in. And
Yeah.
so, um, and our clients tend to be marginalized populations. So thank you for
Yep.
that input because it's valuable for us to see how everything kind of connects together. We don't live in isolation.
hmm Yep.
And I know you mentioned ethics earlier. Um, aside from like just the general statement about it's in our code of ethics, like what would you point to if somebody was wondering what the ethical implications are for political social work in our profession?
Oh man, dignity and worth of a pick something in the code of ethics close your eyes and point to something and it relates to political social work. Literally, it affects. The way I look at it is we have our micro, we have our macro, and we have our meso, right? And then policy affects
Hmm.
all of it, and politics affects all of policy and everything in the micro, meso, and macro levels, including uh, everything that's in the code of ethics, all the nine competencies in the CSWE, handbook for accreditation. I mean, so, many different negative and discriminatory statistics that are out there are directly related to policy choices that politicians are making, maybe or maybe not without the important and critical input of social workers. And so we're responding to what's being done to us rather than preventing it from happening in the first place. And politics
Hmm.
and participating politically can really help with that. And so, yes, we have political participation in our code of ethics, but um, that social justice piece, the dignity and worth of a person piece, I mean, we can be working towards all of those things by participating in political social work. But that's an
Thank you.
interesting question. I hadn't really explored that except for the obvious 6 point whatever it is that social workers are supposed to participate politically. But yeah, every single thing in the code of ethics is related to politics, everything, whether we like it or not.
Yeah, and you brought up a good point about if you touch on any of the areas, the populations, the issues that social workers are dealing with, it touches everything.
Yeah. Yeah, even our own pay. You
Yes.
know, our the social work compact bill where we should be able to travel between states to practice, the payouts that social workers get for therapeutic sessions, Medicaid's always been lower than others, and yet sometimes those are the people that we need to see the most. It's
Mhm.
all political, all political. The DSM-5 is so political. Yeah, so I just think, it really could be incorporated into any class, even the DSM class. Yep.
Mm.
Definitely. Um, and I feel like with ethical considerations comes the discussion of what barriers are we seeing because part we as social workers are part of our community, like I said, and how can we advocate for social workers to get more politically involved if we're not looking at the barriers that they're facing? So,
Mhm.
what are the biggest barriers you have seen um, social workers say to becoming politically engaged?
Yeah, and I want to preface this answer by saying, I've worked at one university and I've worked in one state, in one department. So I want to just preface what I'm going to say with that. So I'll speak to what the research says and some anecdotal evidence with my experiences, but I just wanted to because, some places don't have as many barriers as we
Mm.
might, or you all might. So I just want to
Mhm.
make that clear ahead of time. But the barriers I've seen, students feel overwhelmed by policy just by walking in the door. So some students don't understand why they have to take it. They're there to be therapists, and this is at the MSW level, by the way. Some students just feel like they're not going to be able to make change, even if they're taught how to do it. Some graduates feel as though they weren't taught how to do it, which effectively, which again goes back to us as schools of social work, really needing to step up to the plate and incorporate this into all classes and really show how important it is. Um, I think the whole 20% think it's irrelevant to their work goes back to the branding problem I was talking about earlier, where we've skewed so far clinical, that we've forgotten the roots of our profession and why we started this whole thing. Although, if I'm arguing against myself and playing devil's advocate, it could be 100% clinical social work graduates. They still need to be participating politically, right? So I think it really goes back to the schools and really incorporating it into all classes somehow. whether you have a macro track or not. There's also barriers at the nonprofit level with being able to lobby, not being able to lobby. What does that look like? What are the actual rules? And so educating practitioners who are in nonprofits what they can do and what they can't do professionally versus what they can do and what they can't do personally is important. What else? I think it would be really cool to start highlighting social workers who are doing this work already more to show that it can be done, to get their opinions on what is most effective, and really building that political brand, whether they're clinical or macro, uh, could be a way to reduce some of those barriers. What else? Those are the things I've seen. What have you all seen? Is it similar stuff, or different?
Dr. T?
I would definitely say similar. I'm also seeing a lot of people just not having interest.
Yeah,
Uh, I'm seeing that I don't, I feel like there's a lot of people who they expect the macro level social workers to do all the work.
right, right.
So one of the things that I've been screaming is, yeah, we're going to do some of the work, but we need you to back us. So
Yeah,
like
yeah,
when we're saying, hey, we need a petition signed, we need you to actually sign the petition because
right.
we have to come in droves to make the change that we want to see. And so I'm seeing a lot of that. I think there's also a lot of people who the current climate specifically is running them away rather
Yeah.
than towards. And I think that's just fear of what could happen, right? Because there's definitely a fear factor
Hmm.
of if I speak up or if I go protest or if I do this, am I going to lose my job? Am I going to lose my livelihood?
Hmm.
And so trying to navigate people like how do you do it ethically to where you won't lose everything in the process is really the conversation that I'm seeing not happen. But
Hmm.
when it does happen, people aren't really listening either. So
That's a good point. There are many social workers that I've talked to who are like, "Yeah, I'd love to do these things. I am interested in these things. I don't want to lose my job." And look at the current political environment where people are getting fired for no reason and there's no repercussions. I'm very sensitive to that, and that's a great point. I think that goes back to educating in terms of what we can do better as professors, educating what you can and can't do, and what you can do if someone says you can't do it, and those checks and balances type of thing. And I know we're going to talk in a second about how to get involved. But micro social workers are critical to this entire thing because macro social workers and legislators, we need to know what the problems are.
mhm,
We can't assume what the problems that clients are facing are. We need, and short of us going into the communities, which we need to be doing anyway, and asking what the problems are, we need to hear it from micro social workers on the front line. So if nothing else, tell us what the problems are so we can help fix it. And I have some ways that micro social workers can do that very, very easily, and it barely takes any of their time. Because another barrier that they always say is we have full-time jobs as therapists. We don't have time to participate politically, and you actually do. And we can talk about that soon, I think.
absolutely.
Yes. And I also wanted to follow up because as people are, like you said, educating people about the barriers and different things, a lot of people are using Google and social workers are using Google to look up information for clients. And in the current age of AI and misinformation, what are some sources that social workers can turn to for fact-based information that we know is reliable? So that, because, like you said, micro social workers are critical, not just for letting legislators know, but micro social workers can touch 5 to 10 plus families in a day. And so
Yep.
they're also disseminating information to vulnerable populations.
Yeah, I created a website called the Political Social Work Initiative through UNCW, and it's a working website. But it's got some good stuff on there already, and it's got definitions of what political social work is. It's got a link on the statistical need for political social work, which goes in depth on a bunch of different negative and discriminatory outcomes at the federal level and also the North Carolina level, not the Texas level, but you get the idea. And if you, and I have all the references listed, so you can look at those lists of references and be confident that those are some places that you can begin to look at for good information. And you can also go to the list of social work related organizations and think tanks, institutes, and foundations, and all of these organizations. Again, you guys would want to focus on federal level, not North Carolina, but you can also look at the North Carolina ones and get and find the same similar ones in Texas. And these are also some good references that offer good information that people can trust. And the think tanks as well. You know, you may or may not notice that this list of think tanks, if you once you go to the website, is skews progressive or nonpartisan or bipartisan. And that's because traditionally speaking, typically in politics, a lot of the things that we want as social workers skew progressive. But I also didn't want to put anything that would be anti-social work values onto the website. And so, I think there's a really good list here of institutes and centers for justice and foundations like the Annie Casey Foundation and Brookings Institute and Center for American Progress, things like that. And those are also some great places to go. In a perfect world, a lot of our research papers would be open access, but the way that academia works is you publish a paper, it has important findings, but it's behind a paywall, unfortunately. So I think finding good, trustworthy social media sources that show their citations and references in their posts is also extremely important. And there's a lot of crap on social media, but there's also a lot of great people talking about really critical things with data that has been vetted that I think is really important to start building that out for practitioners and students. So finding those in those areas, what did I say? Statistics, organizations, think tanks, and social media people. Yeah. That's how you can combat misinformation. And also learning to research for yourself. If you see a stat and you're not sure where they got it from, try to find it. And you'll get better at it as you go. It's a skill that you can build.
So now I wanted to just circle to a question I skipped earlier. Um, if you had a magic wand, and this is for everybody, if you have a magic wand and you could fix one issue that is most impacting social workers and our clients today, what would you use that magic wand to fix?
Yeah, this is cheating, but inequity is what I would fix because inequity encompasses things like poverty. It encompasses things like meeting basic needs, it encompasses healthcare, it encompasses education, criminal justice, policies for immigrants, policies for LGBTQ populations. If you can fix inequity, you can fix a lot of stuff that we care about in social work. I was thinking about saying poverty because poverty is directly connected to a lot of issues we see in social work. But I think inequity encompasses poverty and all these other things nicely. So, how do we fix inequity? Uh, I need more than 8 minutes to talk about, but I think there are ways that we can certainly begin to address um, some inequities that we see in these different topics. But yes, if I'm saying one thing, it's inequity.
I'm still
Do
in
you
his
all
answer.
have, what do you all think? Do y'all agree or disagree? And that also encompasses for me discrimination and racism and oppression and things like that. Because one of the consequences of those things is inequity. So again, I'm cheating with that answer, but what do you all think?
Well, I'm glad you had add-ons.
Yeah.
I'm still in his
Well,
answer. That's
yeah,
what
I
I
loved
agree.
it. I say like make hate wrong again. That's what I
Yeah.
say.
Well, and one way we can do that is electing more women, more people of color, more LGBTQ individuals, getting a more diverse set of legislators at the local, state, and federal level, because then it's not always perfect doing that, but
No.
more interests will be addressed doing it that way than electing a bunch of straight white men. And the United States is behind a lot of other countries just with gender. Like I think I don't remember the last percentage. I think it was still less than 30% of legislators are women. And in other countries,
Yes,
they have 50-50. Not all of them, many countries
right.
have political systems that are worse than the United States, but you get the point. So that is one way, because I'm talking about a lot of problems. One of the solutions is to elect a more diverse set of legislators at the local, state, federal, and even things like school board, things like that.
Hmm.
Yeah, I would even add to that and say not only just race and gender, but also when it comes to their backgrounds, right?
Yeah.
Um, as far as I know, there's not that much diversity in backgrounds either.
Nope.
So a
Nope.
lot of lawyers, I mean,
Yep.
there's a few social workers, but there's not
Yeah.
much political science maybe.
Yeah.
But there's not much diversity there either. And so maybe even going to back kind of to what Dr. Conley said is teaching people more about the legislative process.
Hmm.
Because I mean, outside of sixth grade, if that's not your specialty or you don't elect it as a elective in high school, that's about as much as you're
Hmm.
going to get about the process and how it works and how to get through as someone who's not a lawyer or in one of those other fields. So,
Yeah, one of the things we try to do in all my classes is the legislative process and how to navigate congress.gov and ncleg.gov and how the budget process works and all those things, because it also speaks to where you can advocate in that process.
Yes.
And things like parking at the General Assembly, things like that, those all add to fear. If you fear of the
Yes.
unknown, if you don't know how to do any of those things, you think you might do it wrong. You don't want to be embarrassed in front of people. I mean, my first day as a lobbyist, I sat in the front row at the General Assembly, and someone told me to get up because that's just for legislators. Things like that. Like I didn't know that. So, and I was a professional lobbyist at the time. So like you know, just things like that to reduce fear.
Yeah.
Yeah, for sure.
Or having to go to the state capitol and sit and
Yeah,
wait all day long just to give testimony.
right.
mhm.
Hmm.
Yep.
Yeah, it
How does
doesn't
that
make it
work? What should
easy.
be in your testimony? But yeah, for sure. But there's ways that we can make all of that easier. And I can talk about that in a second if we want.
Yeah, I mean, how would you say with as overwhelming as it all is, what's the best way somebody can get started and get involved?
Get on mailing lists is the first suggestion I would make. Going back to that list of organizations on the website that I have, um, finding an organization that's in your area of interest, so behavioral health, for example, NAMI North Carolina, NAMI Federal, The Sentencing Project is a great one for at the federal level for criminal justice issues. There's all sorts of the Trevor Project for LGBTQ federal, but there's also state level and local level. So getting on mailing lists of organizations that are in your area of interest topic wise, and then getting on mailing lists of the advocacy organizations overall, like Common Cause. We have Common Cause North Carolina, there's Common Cause Federal. And they deal with all the issues, right? So some of these organizations deal with one issue very well and deeply. And some of these organizations deal with a bunch of different issues that have to do with social work. So getting on the mailing list because they're doing a lot of this work for you. They are tracking bills. They are creating email templates. And all of this gets emailed out to people. Typically, they're on mailing lists. Not all the organizations do it, but a lot of them do. So you do not have to lead the charge. All you have to do is use the template, track who you want to send it to. Typically, they'll tell you who to send it to, and add your little personal story, which is important, and send it out. It takes 5 minutes. And you can also really learn how the people that do this every day do it by exploring their websites and getting on the mailing list. And you can do that as a student, faculty, or practitioner, no matter how much time you think you don't have. Getting on mailing lists is always the first thing I suggest. Um, when I used to be a lobbyist, we used to send out a huge document of all of the bills we were following in Virginia, and we would color code them as green, we like this bill, red, we hate this bill, and yellow, we're watching this bill. And other organizations do those things too. And we also used to read the bills word for word, and it's a lot of legal jargon, but we will do again, we did that for you all so that you wouldn't have to do it. It's unnecessarily complicated language, frankly. Um, and so the first step is to get on mailing lists. And that's how you can begin to learn how all this stuff is done. And that'll reduce fear too. Um, what else can you do? You can get involved with your NASW state chapter. You can get involved in the PACE committee, which works for elections. You can get involved with voting as social work, which gets people registered to vote. As we were talking about earlier, that's one of the most important pieces of this whole thing. Um, and all of those things really don't take too much time. Watching webinars like this is important. But the first thing is to get on those mailing lists and begin to network with people. Go to those coalition meetings, go to those committee meetings, and you can begin to build your mentor list, and they can teach you how to do it. Yep, I think for me, that's the first step I would tell everybody, because that's basically what I did. Yeah.
And along with the mailing lists, what what are the benefits of joining organizations like NASW? NAMI is in Texas, and and they do have a membership program, or other political social work organizations. What are the benefits to joining these organizations and being a contributing member?
Yeah, it keeps you informed. Um, it it reduces the time that you would have to take to keep yourself informed. It One of the biggest ways that I've succeeded professionally is through networking, and being a part of these organizations is a fantastic way to network. You'll meet people that you never would have met any other way. Uh, and it really snowballs. So it can really help you professionally and personally by being a part of these different organizations, whether it's those topical organizations or those advocacy organizations or those social work professional organizations. I think it's just a really important piece of being a social worker in general. Yeah.
Awesome. Thank you. We have definitely explored a lot in this conversation today. I did want to pose a question for everybody with all of the information we've discussed. What's one takeaway from this that you're taking away that you hope other viewers take away as well?
I would say one takeaway that I've had is that there is really a wealth of resources and information out there, and the hardest part is getting started. So if you can just get the oomph to get out there and just start looking and get on those mailing lists, then you can easily become more involved.
Mhm. Yeah, and another way that you guys can do this is if there's students watching or faculty is create a political social work club, which we also did. And that's been a great way that students can get more involved and they can frankly be more political than faculty can. They can really do, at least in our school, you can pretty much do whatever you want because they're students and we have a code of ethics. As long as they follow that code of ethics, they can invite whoever they want. And so that's been a great way to kickstart all of this into creating a student club is another way to start. Yeah.
Well, from my perspective, I think that I have to say thank you to Dr. Conley and how passionate and enthusiastic you have been about this work and about this conversation. And I hope just that energy that you bring will catch on to other people who may have hesitated because you've given so many great nuggets during this conversation. So I want to thank you for that.
Thank you. I appreciate it. It's not easy. Sometimes y'all know, sometimes the energy is low, with the way things are going on politically. But I think without so many great social workers doing the work already, it would be even worse, right? Which is what I try to tell students all the time when they feel, discouraged. Yeah.
Okay, and so for me, the takeaway is really just a reminder that social work is political. And so everything that we do relates to civic engagement, political social work, getting out there. Um, you just got to do something, whether it's sign a petition, whether it's tell somebody else to go vote, whether it's grabbing somebody and making them go vote, right? Um, it could just be talking about a candidate. Whatever it is, just do it. And so that's my takeaway is don't shy away from it. We don't have time for that, especially
Hmm.
right now. We don't
Hmm.
have time for that. So step up, show up if you want to see change. That's my takeaway.
Yep. Agreed.
And my takeaway, kind of to sum it up, is that it's hard at a micro level to do our jobs without good policy, but it's hard for macro level social workers to do their job without micro social workers stepping up and providing input and letting our voices be heard, whether it's through the ballot box, reaching out to congressmen, um, following your advice and getting on mailing lists so we can be more involved, like staying tuned in as opposed to being tuned out and making an effort. Maybe we don't have an interest in every single topic that comes through, but as we're specialized, we have a voice and an ethical obligation to share our specialty with with the people who have the power to impact policy.
Hmm. Yep. I think there's also lanyards that social workers can get. I think it's from voting as social work. I don't remember, but there are these lanyards that anyone can get, and it makes registering other people to vote extremely easy. So I would highly recommend. That's another thing that all practitioners can do with their clients, or really anyone, is carry those lanyards around and register people to vote, and it takes like a couple minutes. And there's like a QR thing on there that takes them directly to where they need to go. So that might be worth looking into as well.
And that may be more for outside of state of Texas. Unfortunately, the state of Texas is one of the only states I'm aware of that you have to be registered as a deputy voter registrar. But
Oh,
for any viewers listening to this who are social workers who want to become a deputy voter registrar, we will make sure that our email is included. We can get you information on how to become one in the state of Texas so you can help register your clients or other people in your community.
oh, that's good to know. Is that a state level policy that you all can change to get anyone to be able to register anyone to vote?
It is a state level policy, and I would say various positions within the state of Texas would need to change
Yeah,
in
got it.
order for us to make that change happen.
Right.
And then, so thank you to all of our viewers for joining us for our second video broadcasting. We will it will be rebroadcast, so we recorded the session. That's why there are not questions coming up in the chat. But we appreciate you watching our rebroadcast of it, and we will make sure that you have the link to our website so you can join our mailing list and get updates from us on things we're doing locally in Texas. Thank you, everyone.
Thank you, Dr. Conley.
Thanks, y'all. Appreciate it.